But with Tylenol, don't take it. Don't take it. I want to say it like it is. Don't take Tylenol. Don't take it. If you just can't, I mean, it's fight like hell not to take it. There may be a point where you have to, and that you have to work out with yourself. So don't take Tylenol.
U.S. President Donald Trump on Monday urged Americans, particularly pregnant women, not to take Tylenol, known generically as acetaminophen, citing a possible link between the drug's use and autism. Speaking at a White House event, Trump referenced findings suggesting the pain reliever may pose risks during pregnancy.
The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. So, since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. Because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child the Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms. This gives hope to the many parents with autistic children that it may be possible to improve their lives. That's one of the things that I'm very, very happy about. I mean, this was mostly going to be on how not to have the child affected, but we've learned some pretty good things about certain elements of genius that can be given to a baby, and the baby can finally, to help reach the ultimate goal of ending the autism fever, the NIH will be announcing 13 major grant awards from the Autism Data Science Initiatives. And to be honest with you, to me, that's the least important. It's not even a money thing at this point. There's so much money, but they have to do, and they have to move quickly. When the alternative is that nothing bad can happen, let's do it now. I was just saying to Bobby and the group, let's do it now. Nothing bad can happen. It can only good happen. But with Tylenol, don't take it. And they pump so much stuff into those beautiful little babies. It's a disgrace. I don't see it. I think it's very bad. They're pumping, it looks like they're pumping into a horse. You have a little child, little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good instead of one visit where they pump the baby, load it up with stuff, you'll do it over a period of 4 times or 5 times.
The U.S. Food and Drug Administration, FDA, confirmed it will issue guidance instructing doctors to advise pregnant women against using acetaminophen. Despite Trump's warning, many researchers and doctors dispute any firm connection between Tylenol use during pregnancy and autism.
You know, we're all trying to understand autism. We're trying to find the causes. We're trying to find treatments. And to have, these kinds of statements be infused into the conversation is unhelpful, and it just provokes anxiety. And I think it's going to steer people who are, pregnant to do things maybe against the advice of their physicians. I would say we have strong evidence that acetaminophen is not causing autism. It's certainly not the cause of autism. And so to make that sort of takes away the individualized nature of how we practice medicine and how these medicines are prescribed for families, for the people that they're prescribed for, both during pregnancy and for children. A couple of months ago, many of us in the autism clinical realm, we were approached by our patients. Everybody was talking about leucovorin. It had sort of gone around on social media, and so every patient was asking about this. And so I read up on it. I looked at what the evidence was for and against it. And here's what I concluded. There's not good evidence that it works. There are some studies, but they're small and they're not, the best studies. And so it's certainly not something I am actively recommending. The things that were said at that press conference aren't based in fact. And so pediatricians are going to be, they're going to feel like they're on the defensive, having to defend practice that is based on solid evidence and we have decades of experience with. To have a conversation with every family about why we should continue doing what we're doing, it's just not tenable. Pediatricians aren't going to be able to have that conversation with every family. And so what I'm worried about is that families are just going to say, well, my pediatrician doesn't have time to talk to me about that, so I guess I'll just go with what this, non-doctor said on the internet.